Seems like a lot has changed in the last 5 to 10 years in terms of what women and men can do to lessen the signs of aging. Obviously, we're all aging, but it sounds like there are some affordable services that are now available locally. Today we have Dr. Suzette Walker, nurse practitioner at Mckenzie Health and Wellness Center, with us to talk about the new procedures. We also have Jan Cornwell, who's going to talk about her experience with the procedure. I'd like to welcome both of you gals. And I guess, first of all, Dr. Walker, let's start with you educating the listeners on what dermal fillers are, what are wrinkle relaxers.
Really, let's start with talking about the two main reasons why we get wrinkles. The first is just the natural process of losing subcutaneous tissue in our faces. So the skin will often fall forward, leaving wrinkles. The other is often what we see in our upper faces, and that is because we do repetitive grinning, smiling causes the crow's feet around the eyes, or looking angry or mad will cause those wrinkles up on our forehead. So derm fillers are really a product that we can inject subcutaneously. Those fill the void of the adipose tissue that we've lost over time naturally. They will benefit the patient by they will reverse those wrinkles almost immediately. The patient will have a good idea once they're leaving the office what those areas will look like. They will change a little bit over the next couple of weeks, but they'll have a really good idea. The side effects that are most common using those derm fillers are pain at the injection site and bruising. There can be long-term complications like with any procedure as an infection or the product can be displaced, but those are very rare. Then with the wrinkle relaxers, those products are used mostly in the upper face, and they really stop the muscles from moving, so you can't cause those frown lines on your forehead or between your eyebrows. Most people have heard of Botox. That's really a brand name. I'm using a very similar product that's called Xeomin. And with all wrinkle relaxers, the risks are, again, pain at the injection site, a little bit of bruising, and they won't be as noticeable as soon. They'll really take 7 to 10 days for the patient to be able to see much of a difference in how those wrinkle over time.
Well, Dr. Walker, these services do sound like something women and men in the area be interested in learning more about. Are they offered like together as a package, or how's it go?
Bob, I'm really glad that you mentioned men. About 30% of the patients that I've seen so far related to these products are men. They don't want to look angry or irritated, and so they're coming in to have some of those lines reversed. To do the best for every patient, would need to see them in a consult so we can really talk about what the goals of the patient are and what products would be best. I can use them all at the same time, but as I mentioned previously, the wrinkle relaxers themselves take 7 to 10 days to really see the full effect, and the fillers we can see more right away, but often the patients will come back in a couple weeks and say, hey, I'd like a little bit more here, can we add that? I can always add fillers, I can't take them away, so I would much rather do it in a two-step process.
Well, I believe I read someplace that this is not permanent like plastic surgery. Now, is that true?
Absolutely true. The derm fillers that I am using actually help your body develop their own collagen. So they will last a year to a year and a half, but they are by no means permanent. The wrinkle relaxers are maybe 3 to 6 months. The more often you have them done, the longer they'll do. So if you've had them repeated a couple of times, you may get 6 to 8 months of the relaxing of the wrinkles on the upper forehead and around the eyes in particular.
Well, as we said earlier, we're happy to have one of your patients here, Dr. Walker, Jan Cornwell. And Jan, can you tell us what made you decide to visit Dr. Walker?
Well, I'm finding as I'm growing older, there are many issues to deal with, and wrinkles are one of them. So when Suzette started offering this procedure in her office, I was interested. She explained the procedure and what to expect, so I was excited to have this procedure done and experience seeing my wrinkles and creases relax and disappear.
So when you decided to move ahead, maybe you can share with us and the listeners, which procedure did you have done?
I had both fillers and relaxers.
And I'm sure that there are a number of listeners who are not familiar with these services. Can you describe the experience?
Well, Suzette was very confident in the procedure, and that actually made it a pleasant experience for me.
I know you currently have a full-time job and a pretty active life. Maybe you can tell us just how long did it take before you were able to resume your activities?
Actually, I went right back to work the same day. There was minimal swelling and no discomfort at all.
Well, I have to believe this is something that a lot of women and men in this area are going to be interested in. Suzette, what's the next move if people want some more information?
The first step is to call the office to make an appointment. Call 810-648-3229. You schedule your free confidential consultation. Once we have that, we'll go ahead and schedule to have the procedures done, or we may even be able to do them at that time in the office, depending on the schedule.
Well, thank you again, Dr. Walker and Jan, for joining us and talking about this exciting new service being offered by Mckenzie Health System. And again, if you'd like more information, you can contact Dr. Walker's office at 810-648-3229 or visit the website at mckenziehealth.org. I'm Bob Armstrong.